I also want to mention that diabetes not only can cause your erectile dysfunction, but it can also lower your testosterone levels. And also, if you're suffering from a low testosterone level, then what happens automatically, you're not going to have any sexual drive. And most men who have become impotent are actually suffering from a low level of testosterone. Testosterone is the male hormone that actually stimulates your sexual drive. There are other reasons why some men also may have low testosterone levels and also may suffer from sexual debility or sexual dysfunction or erectile dysfunction, and is when you have an enlarged prostate. When you have an enlarged prostate, it means that there may be a growth spur, and this growth spur, especially when the prostate is enlarged, it inhibits or prevents proper blood flow from going into the penile area because of the swelling of the prostate. Most of the blood has to pass through those glands to get into the penile area. So whenever the prostate is enlarged, it actually restricts proper blood flow. Now, what would make the prostate becomes enlarged? It is normal when a man crosses over the age of 40 and going up to 50 and 60 and 70 and 80, the prostate will continue to grow and continue to get large. Now, this doesn't happen to all men. There are a lot of men who I know that, prostate really hasn't. They're older men, and the prostate has not really become so enlarged. So it all has to do with an abnormal hormone that is produced in men with enlarged prostate, and it's called, I'm going to repeat it. We've spoken about this before. Remember, we're not talking about prostate problems here. I only brought this little section in so that you can to inform you some of the reason why you may be suffering from impotence. And this abnormal hormone is called 5-alpha reductase. Now, there are many drugs there's one called terazosin that will be prescribed by your doctor if you're having an enlarged prostate, and it is called a reductase inhibitor. There's another one called finasteride, and all of these drugs are classified to be reductase inhibitors. So in other words, this 5-alpha reductase, these drugs tend to inhibit the production of this hormone, but at the same time, these drugs do also have their own adverse reaction, and over a period of time can cause, studies have shown that can lead to prostate cancer. So it means that you need to be very careful if you're on a drug like that, not to stay on it for too long, because it may interfere with your hormones and actually trigger you cancer to develop. But this 5-alpha reductase then stimulates another abnormal hormone, and it is called dihydrotestosterone. Dihydro, like DHYDRO, testosterone. So dihydrotestosterone is an abnormal hormone that is produced by most men, again, who's experienced sexual dysfunction, because dihydrotestosterone pushes down your testosterone, which gives you that sexual drive. When you're as a young man, you're a teenager, going 25, 30, and going up into your 40s, you're still vibrant, you're still vigorous, you can perform well. But as you get over the age of 50 and 60, you start to decline. It's because of low testosterone levels, high levels of dihydrotestosterone. And by the way, dihydrotestosterone is one of the main reasons why men become bald. So if you find, even that as a young man, and you're getting bald, it means that your dihydrotestosterone level may be very high, or it is genetically related. But even the genetic is because of a low an elevated dihydrotestosterone and a low testosterone. This is not our program, but I just mentioned that as for education. So I'm going to go to Lawrence, let him translate, and then we'll come back and talk about premature ejaculation.
Oui, comme Dr. McDowell Doki, il y a l'autre situation qui a cause norme pas qu'à c'est l'onipisado. Il y a cause ça a cause ça que testostérone, ça c'est bagay naturel qui est dans le système là. Bon, ça, c'est hormones naturels qui est dans le système là. Ça, c'est hormones là qui est supposé faire en vie, quoi, un homme. Bon, si vous pas assez ça, ou pas qu'en vie. Et ça, c'est l'autre, c'est là qui a cause problème ça. Bon, il y a l'autre bagay qui a cause, ou qu'on peut dire, hormones naturels ça, qui make naturel santé dans le système là. C'est là où les glandes prostate là qui a venir go. Les glandes prostate là enflées, ça a une cause, ou qu'on a problème ça. Bon, il est normal pour nous, les occasions à l'âge, nous disons qu'on arrive 50 l'année en montant qui glande prostate là normalement quand venir plus gros et quand enflé. C'est pour ça il toujours important pour ça pour bagaille pour ça empêcher venir trop gros parce que si vient trop gros il aussi quand empêcher wed. Bon comme docteur McDowell Loki c'est pas tout nom ça arrivé de la nom qui 60 l'année 70 l'année avec pas de problème c'est avec glande prostate là. Comme docteur McDowell aussi Loki l'année drugs docteur Kaba observé pour glande prostate là avec ça peut une cause cancer à temps. Alors ça là vous supposez porter beaucoup de précautions avec ça. Ça nous cadre là toutes ces glandes prostate là, les trois gros aussi bien pressure avec pisado, toutes ces bails ça c'est bails qui empêcher non wed avec empêcher ça satisfaire be contenter madame et bamzeli.